go ahead and call the meeting to order.
Dr. Chape, I do have one item I'd like to add to the agenda, if that's okay.
Depends on what it is.
I would like to add the primary care agreement with the Northland Healthcare Access to the agenda.
Great.
And you should all have a copy of
I was
it.
gonna say it's already in here. So.
Yeah. Great. No, sounds good. All right. I guess let's start out since I called the meeting to order with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Hi. I'm going to scroll down to the agenda. So since I didn't print a copy and I haven't logged in yet. Do we have any guests or public attendees?
We have one guest, and it's the same guest we've had once before.
Well, let's make sure the introduction's on the
But I
record.
do want to introduce her. Her name is Janelle Krause. She is working on her MSN in public health, I guess, with Walden University. She is now on her second part of her capstone project. And so she will probably be presenting at an upcoming meeting. I'm not sure if it'll be next month or the month after, but her project is really trying to work on her website as far as STI information and education. She's been doing a lot of research on different websites of different health departments and trying to up the game on ours so people can kind of know what the process is for testing, what symptoms are, and have it be more interactive. What we have found is people don't really, you throw a whole bunch of text, they don't read it. So that is Janelle's project. Do you have anything you want to say tonight?
No, you've covered it.
Well, welcome again. It's good to have you here. Has everyone had an opportunity to adequately review the meeting minutes from May 16th meeting? And if so, I would entertain a motion to approve those.
I'll move that we approve the minutes.
I'll second that.
All right, any further discussion? Hearing none, do a roll call vote. Susan?
Yes.
Kim?
Yes.
Michael, yes. Zach?
Yes.
Minutes are approved. All right. We'll move on to old business, the storefront west interest, the request for proposals, Andrew.
So Cindy, would you take those up to Dr. Chape?
Ooh.
So we actually have several.
Who wants to do the honors?
What do you got?
So let's let Zach open them up. I have to stay focused. Can't multitask today. All right, so we have the request for proposals. They're going to be opened by Zach. And I think in staying with tradition, we will vote on these. And I think our preference is that we usually vote to table them.
So, yeah, so I think at least for tonight, so last time you weren't here, but we actually did a field trip and we went around and looked at where the issue is and what we want it to look like. And the issue is really when the rain and wind is coming really strong from the west, that's when we're getting a leaking issue. We don't anticipate that too much in the next month. So I probably just have the board vote that you turn all the bids over to staff and we come back with a recommendation for next month. I don't know if there's any urgency at this point.
I would then move to recognize the names of the proposals that are submitted. Zach, if you wouldn't mind, go ahead and mentioning the respondents.
Okay.
Very
Very
good.
good.
First up, we've got Midwest Glass and Glazing with the contract proposal. Secondly, we have Binswanger Glass proposal. And lastly is the Jansen Glass and Door LLC proposal.
I would entertain a motion to table these for review and recommendations of the executive staff.
I'll second that.
I think you actually have to make the motion.
Oh, I had to, okay, sorry.
You have to first thing. I
Okay.
said I would entertain a motion.
Oh, entertainment. Okay, I move that we take these 3 bids and let the staff review them and then give us some advice at our next board meeting.
Second that.
Any further discussion? Hearing none, roll call vote, Susan,
Yes.
Kim?
Yes.
Michael's yes. Zach?
Yes.
Jeff?
Yes,
Missed you on the last one. All right, then that
it
is
was good
tabled.
for that one too.
Yes, thank you. That is tabled and turned over to the executive team. Next item on the old business agenda is SWO Health Services Family Healthcare Clinic contract update.
So we actually just got the contract had come back to us maybe a week ago. We sent it to our attorney, Jen Snyder. She reviewed it. For the most part, she was satisfied with most of the things in it. On the lease, she was perfectly fine, and I don't know, I'll just fill you in a little bit, Dr. Chape, you may have read it already, but we are going to have basically, and you had suggested the lease to begin with, but the lease is really an important part of their new structure because they are a FQHC, they can't really be a contractor for us. They are standalone. And so the whole thing is moving forward as really, they are just leasing the space and providing these services here. So the lease, our attorney had in fact, 0 changes, I think. But on the agreement, there were some changes. We have sent that back today. We got it yesterday and we sent it back today to SWO. I think September 1st right now is the date we're looking at. I think one of the things we are going to have some discussions with. Originally, I thought they were going to kind of take over the practice or that type of thing. So we have some questions that we'll have to work out with them as far as the record transfer, because now it looks like they are just a standalone entity that's coming in. And so releases are going to have to be signed for every single patient. That's not what they originally kind of proposed, but in my mind, that's how this has to happen. So we're going to have some discussions with them about that. Our attorney right now concurs with that because of how the contract is written. Do you have?
Hey, Andrew, I was gonna kind of, so you and I had talked last week about this, and it seems kind of tedious, but it's also, I think, another way to look at it would be, it's also a great way to re-engage with past patients and get them hopefully excited about the new system, the new clinic system that we're going to have available to them. So from my standpoint, I think, yeah, it's tedious and, it seems kind of almost not HIPAA invasive, but we're reaching back out to people, but we're also kind of doing the marketing side of things to help them know that we have this available.
I think there's that part. On our side, we want to make sure that Cerner can give us the things so we can release electronically the whole record and they can just suck it in instead of like getting all this paper. And I think that's something Dustin's working on. I don't think he has an answer yet because this is all kind of happening right now.
I do have a concern because, and correct me if I'm wrong, which could happen. We cannot, based on that analysis, we cannot release any patient record without their consent, which means an en masse transfer of digital data would be impossible without 100% signing over. So hopefully there's a logistical way that patient records can be transferred not as a one lump group, because then we'd be violating HIP.
Right.
Okay.
That's what we're trying to work on with CERN, is to be able to, I get Susan's release, I go into the database that I can have and say, okay, here's the package. And then I send them the package of all her electronic records, and they just suck it in.
Hey, Andrew, how many total patients are we talking about here that we have to contact?
That is an ongoing question too. Cindy, if we go all the way back,
I think it's like right around 8,500.
but there's some question on whether we go 2 to 3 years back. What's,
Yeah, who's been here the most, what's your recent?
That's like within the last year, it's probably 700.
I think Dr. Parker recommended like we consider new patients here if they haven't been here more than 3 years. So I think that's kind of what we were kind of looking at for some of those, but
the parts of the contract that aren't quite done yet, that we're negotiating with Slope, this is one of the big parts of that. Because they are seeing, at least my recollection being, they weren't seeing it that way. And I was a little sketchy about it, which is why I asked Jen.
Yeah, so one thing with this, I mean, wouldn't this fall under continuity of care?
That's what I was
Where-
gonna ask.
Like, I mean, for larger hospital entities, for us to garner information from an outside facility, we don't necessarily need to get that patient's permission to reach out to them to get additional information. Typically, I don't know what all they attest to all the time when they come into like the inpatient or clinic settings, but I know I don't get like individual consent release forms. There are forms that they sign, but I think it would fall under continuity of care typically.
I was doing a little bit of research on this, and it's one of the things we've been clearing up with Jen is that there is kind of before it was almost like a continuity of care, but now that they're kind of their own separate thing that's standalone outside of us, it'd be essentially us closing our practice, and that's when it becomes a HIPAA issue, is trying to take those records from someone else and essentially them buying this clinic and coming in here for that. So that's where it gets really murky in the waters. That's why we're trying to have Jen kind of clarify that.
I think the short answer is we're going to have all the attorneys get together and advise us on what we can do. And of course, we have our attorney, which is trying to make sure we're doing things in our best interest. And
Well,
I don't think anyone's trying to do anything.
I'd love to
Not right.
not pay attorneys if there's a more elegant solution. And I know you guys are gonna work out the logistics. I would just throw out as an admonition that as long as you can, if we were to maintain access and continued access to those records, and as we have patients come in, if they're continuity patients, they can sign a release at the time and port their information over. You can send out letters asking them to sign so we can port their information over now, but also down the road, a patient that was here 3 years ago, 4 years ago, if nothing's changed, I think we should keep our access to those records for X amount of time and then port those as we get the consents in. I know your point that in the ER, I can pick up the phone and call any hospital where a patient has records, and it's one professional to another, but that is not what is going on here.
Mhm.
Because this professional entity, unless they made a request to get records, which is non-emergent,
Mhm.
patient has to consent. If under emergent circumstances,
Sure, yeah,
You pick
well,
up
in
the
my
phone.
clinic, it's not emergent.
Yeah,
So that's where it's, I
Same
mean,
with
that,
us.
that doesn't fall
We do
under
the same
emergent
thing.
circumstances.
I can
either.
call any hospital in
Right.
Kansas City and
Yeah,
get records.
because we're
that
one
I'm
one professional entity,
Mhm.
and it does fall under continuity of
Mhm.
care there, so I don't need a individual release form for that.
Right,
But with this, I guess if one, I don't know, I don't know how that works with full facilities changing, because I don't
No,
know.
we're gonna, I would just be cautious to not have too much time spent with attorneys cussing and discussing issues when there is a simple, elegant solution that you may want to start with that. And if they deem that we have the right to, well, transfer records, I think that is different than if they're actively treating a patient. Because if we're actively treating a patient and they need information to make decisions, that's one thing. But we can't send them anything where they haven't seen or are actively treating the patient. I think I would deem that as a breach of that. But I throw that out there for you guys. You'll work out the logistics. Just be cautious. Don't let them overbill us.
Right, so, well, Swope won't bill us for any of that.
Oh, the
because-
attorney.
And our attorney is just, really, at this point, we'll be talking to Swope and ask them how they are, like, they told us what they want to do, what legal basis gives us, what's the
Right.
legal basis for doing that? And then we'll have Jen just make sure that that is sound legal reasoning, and then we'll follow that path.
Anybody else have anything on this? In the interest of expediting the meeting, let's move on to reserve accounts policy.
There's a draft, and we discussed this a little bit last meeting, but we just wanted to make sure if you had any questions, concerns over it. Page 1 or page 11, I guess it's in our packet. The operating reserve on number 3 is not intended to be transferred, donated, or otherwise permanently conveyed to any other individual, private, legal entity, or governmental entity. Like if another governmental entity in Platte County says, "Oh, we see you have thousands of dollars. We might need that won't happen." Page 12, under building reserve, we did the minimum and maximum amounts. This was our point of discussion, whether we were going to go on the inflation rate or whatever. But with legal input, we kind of left it with the amounts here. Questions, concerns? And then on page 13, I think that basically says anything would have to have a vote of the board. You cannot just.
And I think one thing, so Jen reviewed this, and a lot of these are her changes, Dr. Chape. So that first part is in state law that no one can just come in, no political subdivision can just say that's mine. But this part, she just wanted to make sure the board, and I think either you or Dr. Kingsley have said in the past, well, pretty much everyone has said it. 15 years from now, probably none of us will be sitting at this table except Zach. And Zach,
Start up here now.
and Zach will need to say, well, the intent was we're going to take out money out of this reserve fund, but we need to have a plan to pay it back. It's not just a fund that we don't have any plans to ever put back in. So that's what a lot of this section is just coming up with a plan and making sure what it's for and how we're going to pay it back.
Everybody had a chance to review it and feel comfortable with it? Any questions? Any further comments?
All right.
I have one
Okay.
comment
Okay.
or question. Do you have, I know you looked at it, do you have any ongoing concerns about it? We really did try to answer, this is months ago now. Because we had to take it back and work on it. So I think I'm not trying to work on your memory too hard, but I think we were pretty proud of like coming up with most of the answers in finance committee. And we felt pretty comfortable with it. I just want to make sure you don't have any
I don't.
concerns.
My sense of the document is it gives guidelines and structure to the board in the future of how this board wishes this to be handled. And that's really what it does. It gives direction, because any board can go ahead and rescind this and change it and do whatever they want with the majority.
Right.
So I see it as an informational document and guideline. Even if it's put in as a policy, the board can change policy at any time. So I'm very comfortable with it based on that.
And we'll probably be reviewing it every year anyway.
And I'm not sure exactly when your reports will change to reflect this. You know, we have to adopt a policy first, and then it's going to take us some time. But we do intend to have separate accounts
Yes.
for these reserve
Yes.
accounts. And we've already talked with the bank, and the bank has assured us that the amount of interest we get, it won't matter if it's in one lump account or three, it's our collective holdings. And then finance committee is actually going to be looking at, are there other investments we should be doing? And what that might look like. There's actually a state entity that helps local political subdivisions do that. So at some point, I think that's actually our topic for the next
Great.
meeting, but.
Well, then in the interest of time, I would entertain a motion to approve the policy.
I make a motion that we approve the reserve accounts policy.
I second that.
Any objection to closing discussion? Hearing none, roll call vote. Susan?
Yes.
Kim?
Yes.
Michael's yes. Zach?
Yes.
Jeff?
Yes.
Motion passes unanimously. The emergency response plan for avian flu, was this presented at the last meeting?
No.
Okay.
Dr. W, you had asked
I did.
about it, 2 meetings ago.
Yeah.
We were gonna present it last time, but we decided to wait since we knew you were kind of interested in it, so, we wanted to do kind of like a situational update with what's going on with the H5N1.
Proceed.
All right, so the highly pathogenic avian influenza, are strains that are deadly to domestic poultry and wipe out entire flocks.
Oh, I'm sorry, Taylor. Just make sure you speak up loud so it's recorded.
All right. So there are, and some of this is things that you guys probably already are familiar with, and probably already know. But that's opposed to the low pathogenicity avian flu, which might cause few or no signs of illness, and both kinds occur naturally in wild birds around the world. So the main subtypes that have the most infections in humans are the H5 and H7. And the one that's kind of been emerging is the H5N1, which first emerged in southern China in 1996. And it was not eradicated in birds and kind of resurfaced in 2003, working its way through Asia, the Middle East, Africa. And now we're seeing it in almost all parts of the world. And now it's starting to show up in mammals, including humans. So this is a little bit of a map showing where it's been. And like I said, largely it was in Asia and the Middle East in the past. And then in the last couple of years, it has resurfaced and it has made its presence now in the US is a little bit more zoomed in for the more recent years. But as you can see, there haven't been a ton of cases. There's been 4 cases in the US in the last 2 years. One of those cases was in 2022, and the other 3 have been this year. So they've been in Texas, Michigan, and Colorado, and 3 of those have been due to exposures to dairy cattle. So far in the U.S., we've seen no human-to-human transmission. So it's been detected in over 200 mammals in the U.S., and there have been several outbreaks in dairy cattle. And so the first mammal to human transmission was in March of this year. And now there's a lot going on where they're looking into the milk supply, and meat supplies. But currently it is a low risk to the public, to the general public in the US. It'd be higher risk for people who might be working with birds, especially chickens, and now in some cases cattle as well. So essentially how it's affected can be direct contact, touching the bird, by touching contaminated surfaces, and as well as through droplets or dust. So if birds are flapping their wings or scratching or shaking their heads. Again, so it's largely for people who deal with poultry on a daily basis, but it's also gone to mammals. Symptoms can be similar to that of a regular flu, and some people have no symptoms and others has ended in death. I think that's kind of what we just talked about.
If I could interrupt at this point, just a point of information. I think what isn't listed here should be conjunctivitis,
Okay,
because the major symptoms of all of the humans in the United States, they all had conjunctivitis. And just to alliterate on that,
something to look out for.
yes, and they all survived with a historical mortality rate, though, of avian flu at 50%. So conjunctivitis, just for the record, is a substantive symptom, as been demonstrated by the cases so far. Yes, thank you for allowing me.
And would they prescribe any medications for this?
Yes,
Doxycycline or?
No.
Antivirus.
neuraminidase. The N in like H5N1 is neuraminidase.
Okay.
Tamiflu is a neuraminidase inhibitor. All of those patients were treated with it, and there are some other antiviral medications, the utility of which I hope we never have to find out about.
Okay.
All right, so we want to talk a little bit about what's being done at the national, state, and local levels. So the U.S. Department of Agriculture is the entity that investigates outbreaks in livestock and poultry. So currently they're running tests of dairy cattle who are moving across state lines. So now that has become a requirement. They're also testing the ground beef supply. And they have been testing, I think they tested 30 samples over the last 2 months. And then the Food and Drug Administration is responsible for monitoring the milk supply, and they've been testing for milk and milk products for H5N1, and they have done over 300 dairy samples. All have been negative for the virus. So I think the thought is that pasteurization helps to prevent the H5N1 from showing up.
Now, whole milk and unpasteurized milk has been showing up in, just for the record.
Right,
So
so pasteurization would,
it takes care of it.
it takes care of it.
All right, so then the CDC is the lead agency for human health, obviously, and they've been monitoring potential human H5N1 activities through flu surveillance. So this is something, I mean, they regularly do, and they start to pay attention more frequently when there are there's higher prevalence of certain strains. Currently, they are monitoring and testing people who are exposed and collecting data on human cases. They do not have any current travel restrictions related to bird flu and have not deemed it a serious risk. So at the state level, so there's the Missouri Department of Agriculture who does testing on animals in agricultural settings, and the Missouri Department of Conservation who tests wildlife, and both of those have been doing testing on agriculture and wildlife. And there has been a positive bird, it was a wild bird in Platte County in 2022. We haven't had one since that we know of. And then there's no positives in our current agricultural operations. Right, so then the Missouri Department of Health and Senior Services, if there is a case, they do notify local health departments, and they facilitate testing of suspected human avian flu cases, and they also do flu subtyping, and then once they let they have their own state health lab that provides testing for suspected human cases and performs that subtyping. And then once they let the health department know, the health department starts to monitor for symptoms. So here's some of the things that's ongoing right now at Platte County. So we maintain situational awareness. So all of those entities that give out information, they send us, they call the situational updates. CDC and DHSS also has partner call updates to provide information at the national and state level. And then we're continuing to maintain, do normal surveillance. So basically weekly flu reporting from providers, and then also just monitoring any residents who might have been exposed. But the last one was in October of 2022. So for this round, we haven't seen any. Other things that we're doing, risk communication, which includes giving out, sharing those situational updates, making them more relevant for citizens of Platte County, also identifying the higher risk populations, and then talking about preventative measures. So right now they're working on a flu vaccine that could be used for prevention. It does, I think they're kind of in the developmental stages. So I think if they were to come up with that, they would basically start with the high risk population. So largely people who are working with poultry or.
Would they do a trial of that vaccination?
I think they already have it.
Yeah.
They do actually have a vaccine right now.
Yeah.
They're actually, I think, approved. Can't remember how many doses it was, but they've approved some. They're actually mass producing right now, but they're not expecting it to be something that's going to be needed. They're
They
just
had, yeah,
hope for the best, plan for the worst.
as he said, they actually have the vaccine available, but it hasn't gone to an mRNA type distribution. And I'll alliterate on that a little bit. It's because this is going to be a little different than COVID, because the COVID was airborne and this is droplet. But droplets can be in the air, which is why I think we're seeing a little bit of evidence. It's just an N of 4 cases, but close contacts did not get it. Whereas with COVID, we know that you sneeze in a room.
So did you say it would be an mRNA or not an mRNA?
It's not an mRNA.
The
It's,
current one is.
All right. Also, as far as dispensing operations, we do monthly exercises by having harvesters in our garage. We basically get the practice that we would need in case we were to have to do a mass flu vaccination. And we've also used that for seasonal flu and COVID-19 vaccinations. We're also stocked with PPE, masks, gowns, shields, gloves. So ready if that were to come into Platte County. Yeah.
How much are we stocked? And for our staff only, or I guess is there an emergency preparedness regional group that has a stockpile of this? I would just presume, but we have enough on hand for our staff, so we would be able to operate for how long?
I didn't get back to you on that. So we do have quite a bit on hand still left over from COVID. And I know that state still has a bunch of stuff left over. But I'll have that for you next meeting. I need you to.
Well, it's something that is, I want you guys to ask yourselves, how much do you think you would need? Because I'm not gonna be the person telling you what you need. I'm gonna ask you to ask yourselves what you need, because I think everybody at this table wants us to be as prepared in the future for situations as we're going to get our lessons learned through the last pandemic. How's that for saying it politely?
Yeah, right now, I think our PPE is stocked for about 3 months.
Yeah.
And then we will, I mean, I think the thought is we can get through that initial kind of surge, and then our partners at this, I mean, we know everyone's going to be asked. We just went through this, so everyone asked for, that's why there's no toilet paper, that's why there's no mask, no anything.
Good.
But
This is
hopefully we are all better prepared and learned our lesson, because there were health departments that had like 3 days worth, not 3 months worth. So, but then it just starts becoming a issue with, can we get through that amount before it goes? I mean, we're doing the first in, first out inventory rotation, but are we using enough to actually keep up? That just becomes a challenge, right? That's
And when you test for avian flu, how do we?
What is the testing? Tell me about it. What's, you know?
To my knowledge, it's something that I didn't know Missouri State Lab tests for it.
They,
Yeah.
they do.
They
and
have
I think it's
specific-
just a swab.
Yeah, that's what I imagined it is.
Same
I
thing.
just,
Flu swab. but-
Same thing.
And then they type it.
yeah,
Okay,
Okay, just like they do the flu.
yeah.
okay.
Okay.
So yeah, similar dosages.
Yeah.
It's
So-
a subtype.
In other words, if there were suddenly to be human transmission during flu season, their surveillance mechanisms, they type everything that they get.
Okay,
And if they start to see avian flu, they will be aware.
It's just like a flu panel, basically.
Okay.
One swab,
okay,
sent to the
okay,
lab,
good.
they give you a whole panel.
So how do they
full of
test these cattle?
swabs.
Is that how they? It's
Same thing.
Same thing, okay,
Okay.
sorry, I didn't mean to.
Oh,
Oh my God.
Oh, no, we'll get
Or
you
it
a
needs to
swab
be-
and we'll go out.
None of these things.
Or needs to be informed to make
Yeah.
more of a
Okay,
decision.
there you go, all right.
There's also a national stockpile of supplies, but it's, yeah, Kansas City happens to be one of the areas where, one of the areas where the regional strategic national stockpile is held. Don't know exactly where in Kansas City. In fact, I couldn't tell anyway, but, so there is, a lot of the preparation we did in the past was for like an anthrax thing where you would expect a more local response. With COVID, it would affect the whole world. So the strategic national stockpile was quickly depleted and I think even shared with other countries early on. So, yeah, I think as they mentioned, 3 months, we have on supply on hand, but there is also the possibility of some additional supplies in the strategic national stockpile that we could access through the state of Missouri. So, great process.
I was very impressed when I read it. It was well done. I'm sorry, were you finished?
Pretty much, yeah. I mean, I just want to reiterate that the CDC is saying it's very low risk, for public health right now. And yeah.
And that's the best time
Yeah.
to get prepared. for
Right,
it.
right. So we are obviously regularly monitoring this. We do with lots of.
Well, as a board member, I will tell you all, I will bring it up when we start seeing when we see human to human. Because I want Platte County to be extremely proactive and be prepared. And be organized and take the lessons we learned. Okay,
Sounds good.
we'll move on to subcommittee reports.
Hold on, good presentation. I just want to give thumbs up.
Oh, yeah, yeah. Very good.
Thank you.
And
So-
thank you.
So I do want to say, Taylor, once he gives you the kudos, I think that's when you stop.
Okay. Now I have to leave, sorry. So yeah.
I read it and I was like, "Ooh, Dan did a lot of work. Now I know it's her."
Yeah, it wouldn't have been nearly
Yeah, like
that.
that.
Yeah, right.
Like, gosh, Dan, you did.
I think you and I hit
I know.
Every day.
And I'm here all week.
And I apologize if it seems passive aggressive, but I thought it needed to be on the record that we are looking at this, we're questioning it.
We
And
discussed for sure.
we've discussed it so that when it comes back up, we won't be as reactive and that we've been proactive. And it's nothing official to say that, but I do think at human to human, the board should at least have some discussions, consideration, and or we don't have a preparedness committee. But the folks with preparedness, I think we would invite to a board meeting to start talking about things and see if there are anything we can do for the Platte County at that time.
Sounds good.
So, Dr. Chaffee, I do want to thank you for bringing it up and giving us the opportunity. I know I was kind of joking about who did it. Taylor had staff that was working on it also, and I do think it's, I thought it was good once we kind of got into it, just to make sure everyone knew this, like, we are doing stuff every single day. Unless there's the emergency, you don't see it. But that constant monitoring is the only way we know if there's an emergency a lot of times. So thank you for giving us the opportunity to showcase our EPI team and Taylor. And
Thank you. That was
very
my,
nice job, Taylor.
it was my intent, because I think we need to bring it on the record, all the work you guys are doing. But it's sometimes, at rare times, there's items that make you go, then that's our job too, to allow you guys to take a little bit deeper dive on it. So I wasn't trying to catch anybody or, if I wanted Pot County Health Department to have an opportunity to briefly take a sense of what's going on with it, because I already have. I wanted to make sure that we're doing all we can. Thank you. Director's report.
So our family healthcare numbers, so last month, we all kind of noticed the big bump for the April numbers and just wondered what was going on. So the numbers have put right back down. So it was an anomaly.
Actually, I think I have a rationale for that. We were moving into this building last couple weeks of April into the first week here. So I think our schedule was a little bit more like after looking at it, like, oh yeah, that was we were busy during that time period.
Okay.
So
can you go ahead and scroll down? So I know we already talked about the transfer to slope and that type of thing. I do want to mention Janice Marshall, who is our nurse practitioner. She is resigning effective effective like 5 p.m. on August 1st, because that's back to school fair. And she is actually going to make that her last day. But she is resigning her position, and she is elected not to go over to slope. I'm not sure exactly what she will be doing. She just said she had other things that she wanted to pursue. But I know she has put her heart and soul into caring for patients here. She's an awesome practitioner. Wherever she is going to be quite fortunate. It's unfortunate that it didn't work out, but we want her to be happy, and I'm sure Slope will have practitioners come and deliver great care. So, but we will miss her, and I know it's a tough decision. That being the case, I kind of mentioned September 1st was the date Slope is going to be taking over right now. That kind of leaves us a month without anyone. It looks like Dr. Parker will be able to see patients for those first 2 weeks for sure, longer if we need her. But I think what our plan is to shut down the clinic for those 2 weeks, last 2 weeks of August, so we can do all the transition, get stuff moved, get all the computer stuff set up, get everyone settled in for that September 1st date. Now, if they push it back, we'll have to have Dr. Parker cover for a little longer, and she's willing to do that. During those last 2 weeks, that does cause a little bit of a gap, but Dr. Parker will fill in for anyone that's an emergency, and people can start their care at Slope at one of their other locations immediately. I mean, as soon as we start sending out letters and stuff, there may be potentially people that are like, well, if they're going to be gone, I might as well get my care started there.
And their next closest location is
Riverside.
Riverside. So it's not too far. And
It's not.
does anybody feel like this is, I think there has to be some logistical timing to get the transition and physical transition of things.
Absolutely.
Now that, regardless of the resignation of Ms. Marshall, which I think everyone here is disappointed but happy for her to prove it for her, we'd have to do that anyway. So, and in those letters, I'm sure you've already thought about making sure they're aware of the other location that they can seek care.
Yes.
All right.
I'll just mention it about Slope. We have great technology in this building as far as fiber lines coming in and our switches and all our network equipment. However, Slope is actually wanting to bring their own network switches and their own fiber line into the building. Of course, it will all be at their cost. They'll utilize some of the wiring that's existing because it's as simple as just plugging things in. And their patients will utilize the Wi-Fi that for guests that everyone uses here. so they won't have a separate guest Wi-Fi. But it's all about their cybersecurity measures, their consistency amongst all their clinics. But it looks like it'll be easy to accommodate them, and it won't make any major changes to, it's nothing that can't be undone, and it won't have any impact on us. One of the things, and there's a certificate at the end, but Don Fadre and Janice have been involved with Reach Out and Read with the Family Health Care Clinic for some time. So during a recent site visit, Reach Out and Read shared some of our stats, and there were some that are pretty good. 100% of parents, caregivers reported receiving literacy advice at their appointments. So it's something that we don't forget to do. And then 50% of them, of the patients, now it's kind of a self-reporting thing, so you have to take it with a grain of salt. But they said they're going to read more often because of this advice. So that's pretty impressive. Go ahead, scroll down. So the building, we know about the water leak that we had talked about. We are nearing we're out of our regular warranty period, except for the HVAC. The HVAC is going to go nearly to the end of the year, which is good because we are still having HVAC issues. We actually have a meeting tomorrow to discuss that with 2 HVAC companies, Straub, Brian Ruoff, and Brian, I can't remember his name, from the engineering company that designed this. What's that? Yes, sir.
So the problem was not fixed by putting the most robust bathroom exhaust fans I have ever seen. It's as the admonition of our architect and the engineer that would solve it. I just want that on the record. It has not been solved.
It has not.
Okay, but we are compliant with code now with our bathroom exhaust fans.
Yes. Touche. But we have a meeting, and my gosh, I'm just so ready to not have crazy humidity and be able to cool. Cindy texted this morning at 3:12 or whenever she gets here.
3:12.
Okay, it may have been a little later than that. But it's really hot and muggy, and so
it's adversely affecting the ability of this office to function. At some point, one might consider asking our council to weigh in on an opinion here. Because if this was adversely affecting direct patient care, which it may, this needs to be taken more seriously, because this is not a difficult engineering problem. I have my own opinion is I suspect it's a who's going to pay problem. And I think I would suggest that everybody consider in the back of their minds the need down the road, possibly at the next meeting, to take some action that would press these contractors to fulfill the contract for which they have already been paid.
I agree
Now-
100% with that.
Now over a year out,
Yeah, this has been going on a long time.
because if they don't have, you can pass this on. If one of the board members is saying, if they don't have a plan within a month, I'm going to suggest we have legal pursue this. That's just me rendering my opinion. So hopefully helps you guys get this fixed faster.
I have no issue. I'll love to say that tomorrow in our meeting. But yes, I think you covered it.
That's ridiculous.
So Dr. Kingsley and I talked about this a little bit. I just want to bring it up. Dr. Kingsley always tells me I don't brag enough, and so I'm trying to remedy that. But Taylor, myself, Dan, Dustin, you went, right? Or did you not go to
I
the
didn't make it,
open? Okay. To the open house of Jackson County Public Health. They have a newer building that they moved into, so they remodeled, they did a lot of work. It's pretty nice. It's in a nice location, but I just wanted to talk a little bit about the open house itself. They did not do it they moved in actually a year ago. So they waited an entire year before they did their open house. And I was teasing Dr. Kingsley that last year when he was saying, oh, we want to do it like the day we really open and all this stuff. I'm like, oh my gosh, I cannot handle that. That's just, you're going to make me go crazy. And we did it in June. We did it almost a year ago, almost exactly a year ago. And we had the major kinks out and things went really well. But their staff is about double what we have. We just did such a nice job with our open house and the planning and the microphones and our speakers and who all came. They probably had about the same number of people, but I think a third of them were their own staff. So they didn't have a microphone for Frank White to talk, and the legislator that talked, I don't remember her name. So you couldn't hear, and the room was about this size, and with people in it, things are loud. They didn't have a ribbon cutting. They didn't have a cool plaque. No flowers, no food. Ours was just so awesome. Dr. Kingsley said, well, Bridget should have came, who's the director there. She should have came so she could have stolen all our ideas. Do you want to say anything, Dr. Kingsley?
I agree with everything you just said. I thought we did an awesome job, and it's unfortunate, like you just said, that she didn't come to ours. Then she could, seen kind of how to do it, and copied us or whatever. So I agree with that. Good job.
Then down to our.
Too busy. Coaching the Monarchs.
I need to see the numbers. I don't have them memorized. So at the end of May, that puts us at about 41.7% of the year. For revenue, we have collected $3,272,169, or about 3/4 of the revenue that's in the budget. We'll catch most of the other quarter at the end of the year. For expenditures, we are at about 38.7% of the year, so just a little bit below where we were last month. So our spendings, the budget is weird because certain expenses come at certain times, but we're right on track and don't expect at the moment any kind of big changes or ask or anything. We are about 624,977 more than we were last year in our money market account. Now, that's not really reserves. We're going to be moving stuff, and so it'll look different. We'll be able to know later exactly kind of apples to apples, but things look good. Okay.
I think a lot of the things in my report have either already been talked about or will be talked about later on in the agenda. One thing that might be kind of interesting to you that happened last week was a truck accident.
Yeah. Graydon.
This one was actually on I-29.
Oh, okay.
It happened in Kansas City. And in the Kansas City jurisdiction, generally, the Kansas City Health Department comes out to handle any truck accidents involving food. But in this case, they towed the truck and the trailer to a facility in Platte City to house it. So it came into our jurisdiction, so we became involved, but it was Crown Royal. And it was, the truck caught on fire, so it damaged part of the trailer, and all that smoke is just, it really finds a way into every little crevice that you can imagine. And it goes right through plastic, not that the Crown Royal is in plastic, but it's as if the plastic's not even there, the smoke goes right through it, so you can taste that smoke flavor. But anyway, it came from Canada, it was on the way to California, and Crown Royal wants it back. So we're kind of struggling with that right now because the state of Missouri doesn't want it to leave the state of Missouri. Crown Royal wants to make sure that it gets disposed of while they're watching, because they're very particular about that. They don't want it to get into commerce where people buy tainted Crown Royal and then say, "Oh, Crown Royal sucks," you know. So, but anyway, I thought you might find that interesting.
Yeah.
That we get involved in things like
So,
that.
so Dan, quick, sorry to interrupt. So why does the state want to keep it here? What's their reasoning?
I think it's because the logistics would be such a nightmare because they'd be crossing so many jurisdictions as they transport it back to Canada. Every county we'd have to hand it off to the next county.
I didn't.
So you'd have to have inspectors waiting at each county line and then the state line. And
So can we just make this a federal thing since it is interstate commerce?
we talked about that with FDA, and we haven't really got an answer on that. Right now, it's in the state of Missouri's hands, and I think they're working with Crown Royal to make a decision on what to do. But every day they keep it in storage, it's costing Crown Royal money. So I suspect they'll come to a decision fairly quickly.
Yeah, so on the truck wrecks like that, a lot of times we end up doing some of the work, but the state ends up making some of the decisions for us, so. But it's always interesting.
It is interesting. A lot of
Where
times
was the exit? Where was the?
it was near Mexico City.
Okay,
Exit. A lot of times the accidents happen in the middle of the night, so and they're not common, but they always seem to happen at the most opportune time.
Because it's usually weather, or a lot of times they'll be weather related. So anything dealing with any food that's ready for human consumption, we have to go address.
Okay.
But if it's animals, we don't. So like it could be chickens that are meant to be eaten, but they're not, they're still live.
They're alive, yeah.
We don't have to deal with those. We're very happy about that. You will not find us chasing cows and pigs and chickens. But we will be on the side of the road oftentimes counting hams or counting cans of pork and beans or whatever it is.
Yeah, it'd be interesting.
In the snow.
Always. Yeah. Yeah, other than that, we do have a couple of intern candidates that we've interviewed. I think we have another one next week we'll be interviewing. And the one next week, I think, is actually going through the Pathways program with the Missouri Department of Health and Senior Services. So that'll be a paid internship. So we're trying to work through we don't really want to have one paid intern and one unpaid intern at the same time. It just seems like that might be awkward. So we're trying to work out the semesters there.
And just to clarify, we're not paying them. It's through the state program is how they're getting paid. So there's nothing coming out of our budget for that.
And another thing to report, this wasn't in my report because it just happened in the last couple of days, but we are receiving about between $4,000 and $5,000 additional funding for the maternal child health contract with DHSS, and we'll use that. We run out of money in that contract usually in April. March, April. So we'll kind of do a little bit of backfilling for the personnel time, but also we'll purchase some additional items for maternal child health functions. We do. And then one final note, we did extend our contract with Central Bank of the Midwest to provide banking services through June 30th of next year. And then there's the option to extend for 2 additional 1-year terms if that's what the board wishes to do next year.
But we'll be discussing that in finance.
In the community health education report, you can see that Platte County R3 honored the Platte County Prevention Coalition, which we're very heavily involved in. There's a photo of that on the top here. This is one of our health educators. The
It's your supervisor, isn't it?
It is the health education supervisor, yes. The 5K that is put on to raise money for the back to school fair was a success. I think I don't remember the exact number of runners, but it was definitely the most we've ever had, in the hundreds. Usually, I think our first year we had in the teens, the number of runners, but it's increased each year. So anyway, here's our famous sport worker activities. In the harvesters report, we served 56 families last month. And the environmental health report.
It's interesting. Someone came from Wellington.
Yeah, that's a far
east.
way.
That's
They must have
quite a
been
ways from
down
here.
or something. It's in Lafayette.
They were driving by and.
Headed to the airport. Wow.
Well, and Dr. Kingsley was here and saw all the cones, and I told him that was the autocross track. And he went through. Dustin?
I only hit like 3 or 4 cones. It wasn't that bad.
So probably one of the biggest things I've been working on is just the family healthcare transition. I think, as Andrew said, we've been meeting a lot of committee meetings with our different groups and trying to get all that situated. I think the biggest holdup is with Cerner and trying to get all that data and like how they're going to report it. Because like our goal is to be as HIPAA compliant as possible, and the ability to send like those individual files. We have a lot of drafts of those letters we're to send out, as well as like templates for our website. We'll have information posted on there, as well as our social media pages. We're just waiting for a couple more confirmations from SWOP before we post all that out, because we want to make sure we're putting in correct information and all that. I think one of their holdups is they're still working on getting their calendar built for the new clinic, as they're still finalizing this last date. Once we have that, patients will actually start being able to go in and register the new paperwork and sign up for future appointments that way. You still a lot of the thunder with like all like the plans with Janice and those Dr. Parker in those meetings. So we'll have those going on. Taylor and I did graduate from our Emerging Leaders Academy on Friday. There was a lot of that going on that happening. I know Andrew's hands were pretty sore by the end of the day. We did meet and discuss with some members of the EPI team about the declining vaccination rates for particularly with measles in school-age children. It's been declining for numerous years, slowly whittling away. After COVID, there was a pretty decent drop down, and we're continuing to see that more and more as we're seeing more measles cases pop up across the U.S. So we're kind of working on some strategies for that. We actually have, and I'll be sending an email, and it'll be in the newsletter coming out this month. Hopefully Aaron's gonna put it in there, but there's a documentary called Shot in the Arm. They actually started making it regarding the measles outbreak back in 2019. And while they're filming, COVID occurred, so then they kind of pivoted to that. But the Indiana University and their immunization coalition actually purchased the rights for it to make it streamed as a webinar and like continuing education course. So it's like a 1-hour video kind of talking about that and vaccine hesitancy. So we're pretty excited for sharing that, and everyone will be able to have a chance to watch it. Still working on precepting with my MSN students.
I have a question. Would that be something we put on the website or?
I don't think the licensing is allowed for it, but we
Okay.
can certainly do sessions that will meet the demand.
You should be able to, yeah.
Okay.
Like there is a link to it where you can register with the Indiana University and then you put your credentials in there, then you go and access that.
So we can publicize it and get,
Okay,
make sure it's available.
okay.
I think that's pretty much the bulk of it. I know ID and rate manager did attend the Missouri WIC Association meeting in Jefferson City this year. They do have a billboard up in Platts, I think it's in Platte City right now. They just put up with information regarding WIC out there. And we had our quarterly STI update for the public health nurses and all that. That's everything else listed in there. If anyone has any questions for me about that report.
I did have just an interesting comment. I had somebody reach out to me and ask me why the health department was going to discontinue giving vaccines. And I said, I don't know where you got your information, but I think it has to do with people maybe getting confused about the family health clinic changes. So that you spread the word that that is not the case, and I'm not exactly sure who's saying that, but that's really incorrect. So that's I'm not sure how that got started, but
Well, I know Aaron actually is posting on our social media now your back to school shots before you have to wait a long time and here in August where it's really, really busy and
well, this was
Try.
the senior citizen of our, who lives in the county. So I'm sure I don't know how that got started.
Sometimes just one misinterpretation,
Mhm.
then you tell someone else and then they
Yeah.
tell someone and that ends up
Just
on social media and then it's the truth.
And it could be because we've had a lot of senior citizens in particular asking about the next year's COVID vaccines and when they get that. It's like they haven't announced it yet. It's not anything possible. So that's could be where misinformation and just misinterpretation coming from.
Do you want to just mention Taylor and Dustin's graduation? What was there, 75 graduates?
Give or take, yeah.
And it was an interesting thing. It was out in Lawrence and they invited all the managers or supervisors of the graduates. It was kind of funny in that this is just like a 4 or 5 month leadership training. And all the people that came, like kids and family members and all these people, it was like, wow, this must have been really hard because all these people showed up, but it was great. They did not wear like paper caps and gowns like in preschool, but it was a nice experience. And one of the things,
Did you guys make valedictorian?
We didn't officially have a valedictorian. We did have
Man.
her for the class who self-proclaimed herself as the valedictorian.
Is that Taylor?
It's true
No.
leadership right there. That's leadership skills right there.
Yeah.
but it was good and they had some good speakers. Taylor?
All right, so accreditation, I think the last time that we spoke, we had just turned in our readiness assessment. So we received the report back from the Public Health Accreditation Board, FAB, and they gave us these percentages. I'm gonna scroll down a little, Dan. So they divided up, it's kind of a weird way to do it, but they divided into the 10 different domains, and then they divide it by ready, mostly ready, partially ready, and not ready. We tried to just highlight it to show the areas where we need to work on, and then the green shows we have 60% more complete. The red is the large areas that we need to focus on, and the yellow is kind of in between. So they said big areas that we need to work on are workforce development, performance management systems, QI projects, quality improvement projects, and a strategic plan. I don't think any of it was a surprise to us. I think we knew the areas that we need to be working on to get to accreditation. So that is what we're currently working on.
Now, I do want to just interject some of the areas that we were big on being ready or mostly ready were the community health assessment and community health improvement plan. And the reason I want to mention it is I have a memo requesting approval for some spending, and that is largely why we are ready for that.
So yeah, on the next page, it talks a little bit more in depth about the areas that we have strengths and the priority areas to focus. Is there anything else you want to add before I move on to?
I think a lot of the things we have to work on is, updating we have a ton of policies that we've written over the years, but updating them documenting things. We do a lot of things, but we don't always document them great. And so, or we don't also analyze how we are doing things either. So there's a lot of room there, and I'm hopeful that we can get a large chunk of this done before Dan leaves, because Dan has a lot of that institutional knowledge and he's a prolific writer too. So we look forward to just working him to death before he retires. So that'll be good.
So then in addition to that, like Justin said, we graduated from the Emerging Leaders Academy. I also attended the public health improvement training, which was a training largely focused on accreditation and quality improvement. It was in New Orleans this year. I made lots of good connections, met with some people, got lots of good resources. So I think that was really helpful to attend. So the community health assessment, so we're going to talk a little bit more about this later, but we are starting a new CHA cycle, and we do it with the Northland Health Alliance, which essentially is made up of us and Clay County, and parts of Kansas City. And we are essentially in the beginning stages of that. We're having a visioning session on Monday that will be with community partners. We're going to be hosting that here in this room. So I think we have about 60 community partners that have already committed to coming in person, and I think we're going to have about 15 that are going to be virtual. So that's just to kind of get community partners, ideas, assessments, talk about asset mapping, and other various things to get started on that process. And then another thing is I was on NPR to discuss tick-borne illnesses, and specifically alpha-gal syndrome. It's the one that causes the red meat allergy. So that was exciting. That was my debut performance on NPR. And then you can see the communicable disease reports. Last month. Questions?
Under the STD, are we routinely testing for, I think it's the most common STD they're finding out now is a mycoplasma blocking on it. It is
I
not.
know what you're talking about.
It is not routinely tested for at other clinics, and University Health has been putting has gotten a grant to do STD testing out in the community in Jackson County, and they're finding extremely high rates of that. And that is not something that's routine. I will give an answer to it, but I noticed that. So I didn't know if our clinics are testing for that, because their current outreach, they're finding a very high percentage of it. And it does have adverse consequences. Catch me after the meeting. I'll have to.
Hey, Mike, does it cause like public inflammatory disease, or what are the issues that they're seeing with it?
Everything, all of the above. Yeah, they get the idea with it, and it's fairly common. I'll have an answer here in about 2 minutes.
So that mycoplasma genitalia?
Yeah.
It may be that. But go on.
Yeah, and we can get back with it too. Cindy?
No, I don't have anything.
So I guess the next thing would be reviewing and approving the bills.
All right. Nothing on the financial report?
No.
Okay. Review and approve bills. Has everyone had a chance to review those? Any questions, concerns? No. I would entertain a motion to approve the payment of the bills.
I move that we proceed with paying the bills.
Second that.
Any further discussion? Hearing none. Roll call vote. Susan?
Yes,
Kim,
yes.
Michael, yes, Zach,
Yes.
Dr. Kingsley.
Yes.
All right, it is mycoplasma genitalium. That was close,
You were. That's how I got it right.
but that
You were
is
close.
something that perhaps this clinic director, I'm throwing out something for you to look into.
Yeah.
I'm not saying we should do it. It's not my role. I'm just bringing it to the attention from what I've seen being done elsewhere.
Yeah, I don't think it's currently offered at the state, which is where we contact most of our labs to. I can check with Weston and see what the price for that would be.
Yeah, Universal got a grant to do outreach clinics and pay patients $20 each to come in and get tested.
Wow.
And they get another 20 something else, but that's actually the most common thing they're finding. So, anyway.
Yeah.
Okay,
No fee resolution, right?
no fee resolution. All right, new business, public health emergency preparedness contract. And
Okay, this is the contract that supports a lot of those activities that we do that Taylor talked about earlier in preparing for public health emergencies. The contract amount is $39,861, which is essentially the same as last year. I think it's about $12 different. But staff recommends that the board authorize the director to sign the public health emergency preparedness contract with EHSS for the contract period of July 1, 2024 through June 30, 2025.
would anyone like to make a motion and read that? So proceed.
I recommend, or I, from the board, agree that we okay for the staff recommending to the board to sign the public health emergency preparedness contract with Missouri Department of Health and Senior Services for the contract period of July 1st, 2024 through June 30th, 2025.
Second.
Yeah, so
Zach seconds. Okay, all those in favor? Susan,
Yes.
Kim,
Yes.
Michael, yes, Zach,
yes.
Jeff,
Yes.
it passes. Membership dues, NHA, Northland Healthcare Alliance, Access.
So the Northland Health Alliance, we've been a member and we were one of the founding members since 2014. It comprises of essentially the Northland, so Clay County and Platte County, both of the health departments. Kansas City Health Department is also part of it for the Northland section that they're in, as well as quite all of the hospitals in the region. So there's Liberty Hospital, North Kansas City, Beacon Mental Health, and a few of the FCHCs, St. Luke's, that are all part of that. And last fall, they hired an executive director to kind of run the day-to-day, and they have kind of revisited the membership structure, and that includes dues. So before we were kind of just paying here and there. When there was a community health assessment, we would spend some money, but this is kind of showing the cost of what it would cost to do that community health assessment, community health improvement plan, and how much we would spend if we were doing it on our own. But since we were doing it with the Northland Health Alliance, it's really been helpful to have that extra support from the other health departments and hospitals. And we've also hired a consulting firm to help out with some of those things as well. And so they have started doing membership dues, and the membership dues are now at $15,000. So yeah, is there anything else that you wanted to add to your question?
If a citizen was to see this for some reason and ask me, what is it that Platte County is getting out of this relationship, what would you advise I tell them?
So, do you want me to answer that?
Go ahead.
So really what it is we are splitting, we're sharing the costs, because if we were doing all this ourselves, it would be around that amount.
Okay.
So what we're doing is cost sharing. So we are cost sharing with the hospitals. The big difference between the hospitals and us is they have to do their community health assessment, community health improvement plan every 3 years. For our accreditation, we have to do it every 5. So we end up doing it a little more often, but we're still saving money because we're not doing all the work ourselves or hiring out all the consultants and all this kind of stuff.
If I may summarize, it's a cheaper pathway for the citizens of Black County to get accreditation for their health department and maintain it.
Oh, that'd be good too.
Okay.
Any
And it's-
questions about it?
So it's a sharing, you're sharing information basically.
And the cost,
And the cost.
sharing the cost to get that.
Okay.
But one part is also there's data sharing agreements among all the entities. We've heard from other health departments that they have trouble sometimes getting some of the data from health or from other hospitals. So this is also a good way for us to be able to get that data more easily.
So is the new plan with like Swope coming in going to cause any issues with that kind of data sharing and communication, or is this completely separate?
I think that we're trying to get them to join as well. So I
Okay.
think
So
they're-
Sam Rogers is already heavily involved. And I do not believe Slope wants to not be at the table.
Okay.
We've actually talked to them about that and said, you know, Sam Rogers is involved. Is that something you'd like? They're like, yes, we definitely, we have a presence and we want to be in the group. So
Okay.
I think they're actually going to be on board.
And maybe the biggest benefit is just the relationship building. You know, we, years ago, like the director knew the CEO of the hospital, but the staff, we didn't really talk to each other a lot. But now, because of Northland Health Alliance, we know the hospital staff, we know Beacon Mental Health, we know Sam Rogers. So anyway, the relationship building is a huge benefit.
It improves our ability to advocate for our patients to those entities.
It does, absolutely.
Any other questions, comments? I'd entertain a motion to, I guess we have to move to approve this as an expense. So I guess the motion language, if anyone would like to make a motion and recite the language, that'd be ideal.
Can I say
Sure.
one thing just to clarify? And I'm sorry, Taylor, I think you wrote verbatim what I said, but it's not very clear when I went back to reread it. And basically, the annual inflation allowance not to exceed $20,000. When I talked to Dr. Kingsley, what we kind of discussed is we wanted to build in some inflation, but if we get the $20,000, what we really want to do is bring it back to the board to reevaluate. We didn't want to have an open-ended, you know, we don't want to come back every year necessarily, but if we get to some point, I think we need to, the board needs to look at it, if that makes sense. So
Yes.
I imagine the board will get to look at it next time we have to approve the dues.
it probably won't go up much over 15.
Well, we have to approve it
Do we have to do
next
it
time
each
we
year?
pay it.
No. Only, I mean, basically, if we have the,
It'd be a bill, basically.
it'd be just, we are approving it for
As a bill.
annually
Okay.
unless it exceeds $20,000.
I just didn't want it to have an open-ended inflation that it just keeps increasing and nobody's aware of what's actually happening.
Yeah, no, I think that's smart.
Sounds
Yeah.
good.
I'd like to make a motion to accept the Northland Health Alliance Platinum membership fee of $15,000 annually with an annual inflation allowance not to exceed $20,000.
Second. Is there a second?
Okay, yeah.
Kim seconds. Any objections? Voting? Susan?
Yes.
Kim?
Yes.
Michael, yes?
Yes.
Jeff?
Yes.
All right, it's approved. Any public comments?
We have the thing I asked to put on the agenda, Northland Healthcare Access Agreement.
Thank you. Sorry about that.
Thanks.
So as you know, this helps pay for our primary care services. Our contract runs from actually June 1 to May 30th. Is that right? May 1st to April 30th. Sorry. I apparently am almost done with this meeting before I'm done with this meeting. But May 1st to April 30th, we know we are not going to make it that long. So we actually amended the contract and Northland Healthcare Access approved it. But if you look at number 6 on page 4, which is termination without cause, we basically said, we will give you 30 days notice when we are ready to terminate the agreement. So that is really the only change from any of the previous years. And they are okay with it, and they will actually be contracting with Slope once they take over. But I would like the board to approve me to sign this.
And then at some point, we need to approve you to inform them of our intent to terminate.
30 days out, and they already know it's coming.
Okay.
They just don't know, like, we don't know exactly when.
Oh,
And they want to make sure that we utilize their funding for as long as we can.
okay.
Any board members like to make a motion? Hearing none,
It fails.
Oh,
See you next time.
Dr. Kingsley, may I make a motion on your behalf? To approve
Yes, you
the
can make a motion if you want to.
primary healthcare agreement to be signed by the director for the healthcare access. Any
All right, and
seconds?
I'll second it.
there you go.
Susan?
Yes,
Kim?
Yes.
Michael, yes. Zach?
Yes.
Dr. Kingsley?
Yes.
Passed. Any public comments? Do we have any closed session items? Having none, I'd entertain a motion to adjourn.
Motion to adjourn?
Second,
yes,
Susan?
yes.
Kim?
Yes.
Michael, yes. Zach?
Yes.
Jeff?
Yes.
Hey, have a good one.
Thank you, everybody.
Thank you.
Bye.
And Dr. Sheffield, you have something to sign.
Yes, ma'am. Sent you an email already about a subject.
Oh, you got
You'll have